Welcome, colleagues. South Africa's HIV guidelines have been updated. This masterclass brings NIMART trained nurses and clinicians up to speed, fast and with purpose. We'll cover the revised viral load monitoring schedule, optimized DTG regimens, advanced HIV disease, and the new 3-test diagnosis algorithm. You'll also explore lenacapavir for PrEP, CRAG management, cotrimoxazole, and TPT criteria, and differentiated service delivery updates. Thank you for joining us. Let's get started.
Yeah. Good, good day, colleagues, and I hope you are well. Yo. It is so chill, bro. What are you guys up to? Do you have your coffee with you there? Cause yo. In my world, it is just too cold, and the darker you are, the more you are not able to cope with cold weather. We prefer the sun, and some of us we become well done when we see the sun. Yes, are you well? Are you well? Give me a sign, maybe a thumbs up or a yes in the chat there to say yes, we are well. We are just on duty. And yeah, it's a very short session. It's an information session about an important masterclass that we are hosting this coming weekend. And yeah, I just want to give you just an idea of what's happening, but also to give you a chance to ask any questions that you may have. Yeah, but go a bata. It's not nice anymore. It's not nice anymore, we are trying, but I don't know. Maybe you guys, bala ba hot flashes, I'm sure they are so happy. Yeah, hey, at least they're like kuta. Some of us are like, no, we don't want this weather is just too cold. I wonder who's laughing like that. Yeah, so welcome. Let me see who's here at Telesia. Welcome, Pel. Funani, Kolisiwe, Shandu, Vukile, Sheila, Adenkosi, Nobom. Yeah, everyone who has typed there in the chat. I was just reading from their colleagues. I'm not able to say hi to all of you. But yeah, this is us. We are the clinical care platform. We always look for opportunities on how we can enhance your learning. This session is not an educational session, but more an awareness for you to know that we have an upcoming masterclass, and I've seen many of you have already registered. But to just clarify, what is it that you can expect, and then we take it from there. So yeah, let me go to my next slide. So just to say that welcome. This coming Saturday, the 27th of June, we have a masterclass which is meant to ensure that our nurses, particularly who are managing people with HIV, they are kept updated. However, the same guidelines apply to anyone, whether you are a nurse, you are a clinical associate, you are a medical practitioner. If you want a quick way to know what has changed with the signed off guidelines, I'll be able to take you through that. Yeah, so it will be based on the curriculum which is probably being run already in some of the provinces. I was blessed to be part of the master trainers, training all the master trainers for the country. So I do have some insight in terms of what has changed and those kinds of things. But yeah, so just to say that I'll just give you an idea of some of the things, though I cannot share the details, but you'll have an idea of what else we are likely to cover. But feel free to use the chat, if you have specific questions or things you feel maybe you want us to address during the update session. So firstly, just to say that if you look at how the national guidelines are written, right, we have what we call the National Consolidated Guidelines, which are not released frequently, maybe every 5, sometimes even more than 5 years, like is the case at this point. But in between, there are a number of guideline updates that are released. So the consolidated guideline, whenever it is written, we put everything together, which maybe some of the changes you would know about because it's a build up towards this guideline, like the one we now have. The 2026 one is the consolidated guideline. That means every other change from the 20, I think the last one was 2015 or so guideline, has now been consolidated into one guideline, including the 2023 guidelines around DTG and dispensing cycles, those kinds of things. They're already included. Now, for our nurses, you would know that you are trained and you require that before you start to prescribe ARVs, you must be trained on nurse-initiated management of ARVs. But that's not enough, because in the HIV world, things change so quickly. That's why some of us, the clinicians, we are always saying, you know what, let me stay away from this science. Because when you see a patient in front of you and you try to treat them, you may be giving them, something that has aged, maybe an older sort of guideline. So we want to make sure that at any given time, we are able to give our best, and this is very important. I also wanted to say that if you look at treatment failure, it has been redefined, because now the national guidelines would include drug level testing, but also the duration has been reduced for a particular group of patients. We used to say we wait for 2 years before we talk about treatment failure, but there is a group of patients where 9 months of an unsuppressed viral load would be adequate. In the same space, the testing algorithm has been changed. If you are still using one test to diagnose HIV, you may cause more harm than good. If you are still using two tests, you may falsely diagnose people to be living with HIV. We have shifted that. When we diagnose HIV, we now require 3 diagnostic tests, or your what you call your cartridges, to be reactive for you to have confidence that that is not a false positive result. So you have to know that if you are practicing something that is outdated, you are putting your patients at risk, but you're also putting yourself at risk, which is not a good thing. We are expected as professionals to remain current in terms of our clinical practice. And yes, we are going to spend at least a day or even half a day, because I'm assuming that you already have the basics. So we're going to be looking at different sections of the guideline and what are the updates, and to do some scenarios so that you are able to practice when we move from there. So this particular session, we call it a masterclass on the updates based on the 2026 HIV management guidelines. We said NIMART because that is the main target audience, but if you feel that you want to be kept abreast on those changes, feel free to join us. It will be this coming Saturday, live on Zoom. That means regardless of where you are, you can actually join and be empowered. And if you need CPDs, you will get CPDs if you have registered. And I wanted to say as well that so the timing, we start very early in winter. I'm sure you're like, it's too early. Let's start and finish, colleagues. So 8 o'clock, by around 2 o'clock, we should be very close to wrapping up. And yes, this coming Saturday, so you don't want to miss it. So some of the things, like I've said, we're gonna cover, how to best diagnose HIV based on current science so that you don't cause more harm. We're gonna be introducing DTG-based regimens, particularly pediatric and neonatal regimens. There's some beautiful changes in that section, but equally, you may find yourself wanting not knowing how to go about it. There are kids who are going to be taking a dose like this today, and tomorrow it's half a tablet, whatever the issues are. We will cover all those, pediatric ALD, etc. The thresholds for doing a crack antigen have been improved. The approach to a rising creatinine has been approved as well. When you are looking at someone who's got a high viral load, how do you navigate and how do you access resistance testing? How do you interpret drug level testing? Because it's one of the new things which has been introduced, and which patients would qualify to get a resistance test earlier than later. And for the first time in South Africa, the consolidated guidelines also include advanced HIV disease. You know, you may take it for granted, but it has never been like that. That you have a guideline that addresses the basic things, but also there's a huge section that addresses things like drug-induced liver injury, renal issues, drug interactions, patients with severe bacterial infections, how to navigate that algorithms for patients who have CNS manifestations of HIV. I mean, it has never happened before to have that level of detail in one guideline. So I think we must really give thanks to those who worked on it, and to make sure that it's like that. We know there's a changing landscape as well when it comes to small things around CPT, small things around TPT, especially in pregnancy. But for pre-exposure prophylaxis, lenacapavir is like there's a lot of noise out there. So we will clarify that pre-exposure prophylaxis. What is it? How to use it? The do's and the don'ts. And we will leave you very empowered. So these are just some of the things that we will cover, which you will have to master. And yes, we are able to cover these because we are not teaching for the first time. These are updates, and we will go into details around algorithms and stuff. So, you know, everything testing and diagnosis, monitoring patients on ART, important sections of the advanced HIV disease section, and then HIV or TB prevention there being very important. So why must you attend? Because you are a professional who's committed to continuous or continuing professional development. But also the community is expecting that wherever they come to us, that, you know, we've got our things on the fingers, on the tips of our fingers, and we are always prepared and ready for them. So yeah, and everything will be based on the guidelines. Where I use something outside, let's say the HIV Clinician Society guidelines, I will make reference. And yes, I'm the instructor for the program, so do join. It will be nice to have all of you joining us. You know, common questions. Some people says, I'll catch up later. I don't know about catching up later, because our people living with HIV, they present every day, you know. So don't don't postpone important things. Reprioritize your life, and see if you can join us. I already know the guidelines. That's what many people think. And as we continue to roll out the training, we realize that even the things that we take for granted as trainers, that no, this one is okay, it's covered, we find that it's not, you know, like the difference between TLD1, TLD2, and you know, I'll share with you a number of scenarios, and you start to realize that it can be tricky, and the implications for your patients, especially in terms of access to resistance testing and timely helping them to suppress again, is so important that we get that classification, you know, right. And yes, the session will be recorded, so that's we always do. So if you do register, but maybe for some reason you can't attend, you'll get access to the self-paced version. I'm sure some of you are like, but it's Saturday. You know, Saturday is the best time to learn because you don't have a lot of commitment. Sometimes you're not in the ward, you're not in casualty. So, and we have tested master classes for a while now, and so far we are able to do that, you know. So how to register for today? What you can do, if let me see if I do have. Oh, I see Kiwi has been sharing the links there. Thank you, Kiwi. You are such an awesome person. Yeah, so you can scan that barcode on your right hand side. There's a green square there. You can open your camera, place it so that it captures that whole square. You'll see a link appearing. You can then read more about the masterclass. But I see Gibita Mang has been sharing the code there in the chat. I think later on she'll also share the membership one, because if you are a member of the platform, especially on the annual fee. On the annual option, you may be eligible for at least a 10% discount for your registration, and it won't take you that long. And yes, we already have a lot of registrants, so please do register before we close, you know. So yeah, just to say, I'm looking forward to connecting with you this Saturday, one Saturday, 7 CPD points, and we will make sure that you are current or you are updated on key changes in the 2026 guidelines. Yeah, that's it from me. Can you imagine? And if you need more information, that is our email address. Our email address is info@clinicalcareplatform.com. You can just drop us an email or send us a WhatsApp message 064 543 3928. You can just visit our website as well if you require more information, and then yeah, we are able to be helpful. Yeah. So yeah, I think at this moment it's just for me to say thank you so much for joining us. Let me just see if there's just give me a few seconds. I just want to see if there are any questions. Funny enough, I can't see just give me, oh, there's the messaging part, just to see if there's anyone who has a question. Sylvester says, excellent, yay. Kiwi has been posting there in the chat. Thanks, Kiwi, for posting. You are a lifesaver. And then I did see there was someone whose hand was raised. Let me see if your hand was still raised. Lebohang, Sekaulela, your hand is up. Let me give you the mic. Would you like to ask a question? Hi, Lebohang. Yes, yes, I can hear you loud and clear. Thank you so much.
Oh, okay. No, thank you for that. My question, we meet there by the diploma there. Yeah, my question is actually related to I just have one question
Yeah,
with regards to that. But yesterday I was doing the low level viremias and all that.
yeah.
So the question is, according to those algorithm, like you will repeat the viral load like 3 months, six
Mm,
months, whatever, whatever. So if a
mm,
patient is on a DTG regimen
mm,
and you've done everything right, you've done your
mm,
ABC, advanced adherence counseling, everything
mm,
is right, the patient is clinically well, CD4 is above 200.
mm.
At what point do you switch this patient?
What is the viral load?
Because the viral load, let's say it's low level, very maybe
Like
250
200.
to, yeah, like 200. And it's just lingering around there.
Yeah,
And
no, you
you
won't.
keep on.
Yeah. In I don't know about, actually, even in the private sector, it won't be done. So those are the things we will
Mm,
discuss at the basic
with the
level,
expert.
at that viral load with that CD4 count, which is high and the patient is clinically okay. It's not going to be done.
Mm,
Yeah, the guidelines will always require that the viral load must be above 1,000. But if your patient has a viral load 200, 500, but they are clinically deteriorating, the CD4 count has dropped below 200 and they're becoming sick, you may need to call for an authorization for that resistance test to be done. But you may need to look at other things as well. Is this a TLD1 patient, a patient who has never been exposed to DTG ever? Or it's a patient who was on PrEP and they failed PrEP, or there's a history of being on other regimens that they have failed, maybe it's a perinatally infected adolescent child. Those are the things we're going to discuss on Saturday. But they are there in the guideline. You must check. I think it's box 11. You must
yeah,
just check.
yeah.
It gives you the criteria. But as a general rule, if the viral load is less than 1,000, your patient is clinically stable, there won't be any motivation for you to do that, Um, yeah.
To switch to like a PI, for example.
Nah, you're not going to
There
switch.
isn't. Okay.
You're not going to
Okay.
switch
Yeah, because I'm
anything.
thinking to
Yeah.
myself, we do, even here at the facility, we do see patients that the viral load sort of lingers around, 500, and
Yeah.
the patient is well. You've
Yeah.
checked. So I'm asking myself, do we call in the expert to, or we just keep a close eye to if it's
Close
going
eye.
above 1,000?
Close eye. You know what close eye? It means
Close
you
eye.
close one eye.
Yeah.
Yeah,
Okay.
but I
No, that
think you
was
can
all from
raise
me.
the issue during our session this Thursday. I'll just need to look what is the focus, but you can raise them. We can go through the algorithms nicely. But generally speaking, also you must remember that for our machines, even if there are mutations, for our machines to pick up that mutation, they require a certain level of the viral load. They also require that the mutation, as a percentage of the overall viral population, they should be at least 20% or more, of the overall. There's certain requirements. And at the time when you do the test, the patient must be adherent. That's why government has introduced the drug level testing. There's no point in doing the resistance test when the person is not taking. And then assess why they have low level viral drug interactions. There are people who take ARVs when
Mm,
they know that they're going to visit you, you know. After that, they take a
mm,
holiday. So just assess as well what else may be going on, you know. Yeah.
yeah, yeah.
Awesome.
Okay, no,
Awesome.
thank you.
Thank you. It's good to see you here. I'm happy. Yeah, and you always have awesome questions. And I think you have helped colleagues to understand as well how easy it can be, but equally how complicated, or
Tricky, yeah.
sometimes it's not that clear what you can do.
No, thanks, thanks,
Yeah.
thanks.
Kibi, I don't know if you're still there. There's a request for the WhatsApp number by Tabang Mahoro. That's 0606. It's the same number, Tabang. The 064. Just check on the thing and then you'll see it. Yeah. Thank you so much. Rea leboga, rea leboga. All right. This is it, guys. These are just information sessions, nothing much. If there are any questions, send us an email, send the WhatsApp, visit our website, register. I can't wait to host you this Saturday. Sharp, sharp. Keep well. Stay blessed. Bye, everyone. Bye. I hope you are good. Buelang merego.
Welcome, colleagues. South Africa's HIV guidelines have been updated. This masterclass brings NIMART trained nurses and clinicians up to speed, fast, and with purpose. We'll cover the revised viral load monitoring schedule, optimized DTG regimens, advanced HIV disease, and the new 3-test diagnosis algorithm. You'll also explore lenacapavir for PrEP, CRAG management, cotrimoxazole, and TPT criteria, and differentiated service delivery updates. Thank you for joining us. Let's get started.